Good morning, everyone. Thank you so much for joining us here today. My name is Miranda Stiers. My pronouns are they, them, theirs, and I am the Prevention Program Manager at the Partnership. And I'm joining from the lands of the Nisenan, Miwok, and Native people in what is now known as Sacramento. Just a couple of housekeeping really quick. I know folks are familiar with Zoom, but just wanted to let you know you can mute and unmute yourself. Live transcripts should be on. If it's not, let me know. You can turn your video on or off. It is completely up to you. You can see who the participants are. You can also click on the chat and enter questions or anything else throughout the time. And if you have any questions, anything like that, then please feel free to, you can use the reactions button to raise your hand or to give us responses. If we tend to speak too rapidly, then let us know and we will slow down. So I'm going to be doing today, and I realize I have somebody missing on our slide, but I will get you added, Jenya. So I'm going to give folks just a moment to introduce themselves. I'm going to popcorn it over to Melodie.
Yeah, good morning, everyone. Thank you so much for being here with us. This morning, we are going to be talking about our paid family leave toolkit. We will be discussing the connection between economic justice and economic inequity with domestic violence. We are going to tell you a little bit about the toolkit, how you can get access to it, and we're going to help invite you to join the partnership in some of our activities that we are looking to launch to further our discussions around economic justice. So if you would like to introduce yourself in the chat, please do that. Our presenters for this morning are myself, Miranda, Angelica Andrade, the Administrative Assistant and Spanish Training Coordinator from the California Work and Family Coalition, and Jenya Cassidy, the Director of the California Work and Family Coalition. So again, if you could please put your name, your pronouns, the organization you're with, and your location into the chat. That would be really great, so that we can get to see who's in the room with us.
And as you're doing that, my slides went forward too fast. We also want to acknowledge that we're on the traditional territory and homelands of California Natives people. This includes over 120 federally recognized tribes, as well as other non-recognized tribes. We always want to hold them in our hearts and space. And if you're wondering whose lands you are living on, we can get that link in the chat. So you can see, sorry, trying to get that into the chat, and it is just not working for me. Thank you, Kimmy, for the rescue. So you can see exactly whose lands you're on. And I encourage you to explore who makes up your territories and what some of the history of our area is.
Yeah, so just again, my name is Melodie Kruspodin. I am a prevention specialist. I use she, her, aya pronouns. I'm with the California Partnership to End Domestic Violence, and I'm calling from Tongvaland in Los Angeles.
And I want to talk just briefly about collaboration. I know in prevention, we talk about that a lot. This project, as we're discussing it, was part of a long-term partnership that we have had as the I know I use partnership a lot, but collaboration that we have been working on with the California Work and Family Coalition over the last almost 5 years now. I know we were members before as well. So just really excited to be able to share what some of that has been and what that has meant for our organizations, and to bring some of that in for you. So as we get started, before we dig in on paid family leave and the toolkit and all of those resources. Want to just launch a quick poll. Melodie, if you can put that up.
I'll get that started.
Yeah. Thank you. Have you ever used paid family leave? Okay, I think we have all the responses we're going to. So I'm just going to share those results for folks. So we've got a good mix of people who have used paid family leave, a couple who have not. Happy that nobody has asked, what is paid family leave? Which would be a perfectly reasonable question if you haven't used it. You just may not be familiar with it, but we're going to talk about that today. All right. So thank you for that. It's pretty even. Let's leave it even split. And this was just a quote by our public policy director, sharing that we were already proud members of the California Working Family Coalition and knew firsthand they have a vibrant network of advocates engaged in engaged partners all across the state. I cannot talk this morning, sorry. This project provided us with an opportunity to deepen our collaboration and really lift up the ways that paid family leave policies and benefits enhance protective factors to prevent violence before it occurs. We knew that as we had started this project, it was not a hard sell in any way, shape, or form, but just helping folks to make those connections of why economic justice is a means of ending violence before it begins. So it was exciting to be able to go into that area, and especially with prevention, to be able to lift up the ways that prevention and intervention are really integrated. They're not completely separate activities, which a lot of times we can kind of view it in that way. So it's looking at what are some of the different ways that we can bring in prevention into the work that we're doing. Some of the positive impacts of paid family leave that folks may or may not be aware of. It can improve health outcomes for both parents and for children. It can help individuals on the economic brink avoid bankruptcy after having a child. And as folks have, I didn't realize, sorry, poll was still up, sorry about that. Also helping individuals on the brink, it's increasing the rate and duration of breastfeeding, which can be associated with lower rates of illness and sudden infant death syndrome. It also helps to reduce the household poverty and financial stress, reducing arguments over finances, challenges gender and cultural relationship norms. Paid family leave is for everyone. It's not just for moms. It also can increase the shared parental responsibilities by giving both parents the option to step away from work for a bit. Fathers are more likely to be engaged in taking parental leave to care for a new child. Some of the other pieces of it is when you have paid leave is allowing people to care for family members to remain in the workforce. Also, workers who access their paid sick days are more likely to engage in preventative healthcare, reducing those long-term healthcare costs. Think about people in your life who tend to wait even though they're sick, and not until it's really, really serious they're having to go to the emergency room. So looking at what some of those options can be before you get to that level. Having paid sick days also improves employee retention. It increases the likelihood of men taking paid time off to help care for an aging parent, reduces the financial stress in the multi-generational families, and parents can also use paid sick days to care for their children. It's not something that is strictly for yourself if you're sick. And with that, I'm going to pass it on over to Melodie.
Thanks, Miranda. So Part of what we want to make sure that we highlight today is how we can help prevent domestic violence through our paid leave policies. So some of you might be familiar with the visual on the left-hand side of your screen. We call it the social ecological model, which really looks at the different levels of our society. So it starts with the individual, moves up into relationship, up into community, and up into the societal. So the individual level and relationship level are a lot of what many of us do on our daily basis over the course of the work that we do. And so individual and relationship work in relationship to paid family leave policies might look like community education and outreach, which often involves things like financial literacy trainings, awareness of programs, and community-centered discussions. So with individual and relationship work, we're really trying to increase the knowledge and skills that individuals have within themselves, and also in the relationships that they have with other folks. So that might be with their family, with their peers, with their partners, and other social networks that they have. And then when we want to look at a more population-centered work, where we can really have impacts on broad levels, we look at the community and societal levels. So paid family leave work at the community and societal level might look like policy-centered and survivor-informed approaches, strategies that enhance community support and increase connectedness, and coordinated services. So I think these are things that many of us are also engaging in when we're doing the work that we're doing. When it comes to policy advocacy work, when it comes to us being in partnership with other organizations in our communities, when it looks at us shifting social and cultural norms, all of that is work that we're doing at the community and societal level. And so really what we want to do is see how comprehensive prevention work must happen at all of these 4 different levels to move our communities forward, to move our society forward, so that we are addressing economic inequity and really advancing these paid family leave policies and doing economic justice work. So the next thing that we want to do is launch another poll. So this time what we want to do is we want to ask folks, what can you use paid family leave for? So we want to see what folks already think or already know about paid family leave. So we're going to put a poll up on the screen asking, what can you use paid family leave for? So the different options that we have are if you're pregnant, for a pregnancy-related condition, to bond with a new child, to care for an ill family member, or to care for an ill friend. And this is a multiple option poll. So you can pick as many of these as possible that you think are appropriate for the question, what can you use paid family leave for? Just give it another couple of moments. Okay, I think we've got just about everybody. So what we're seeing on the screen is that we have about 9 people who said you can use it if you're pregnant, about 9 folks saying you can use it for a pregnancy-related condition, 10 folks saying you can use it to bond with a new child, 10 folks saying that you can use it to care for an ill family member, and 2 folks saying you can use it to care for an ill friend. So what we're going to do is we're going to pass this off to our partners from the California Work and Family Coalition, and they are going to help tell us what we can use paid family leave for and use some of that that input that we've had to go deeper into paid family leave. And so they're going to be talking to us about paid family leave and the different policies related to paid family leave. So I'm going to pass it on over to Jenya and Angelica.
Okay, so hi everyone, my name is Angelica Andrade and I am with the California Work and Family Coalition. And today, like Melodie said, we will be talking about paid family leave. So this is the current staff for the coalition. And like I said, my name is Angelica Andrade, pronouns are she, her, ella, and I am the administrative assistant and Spanish training coordinator here at the coalition. And I can pass it to Jenya to introduce herself.
Hi, everybody. I'm Jenya Cassidy, and I'm the director of the California Work and Family Coalition. Pronouns are she, her, and yeah, we're the two staff here today, but you can see our full staff displayed here. Thanks.
So a little bit about who we are. The California Work and Family Coalition is a statewide alliance of organizations united in the belief that, that all people should have the time and resources to care for themselves and each other. Through organizing, advocacy, and education, we are fighting for a world where all workers and family members have access to paid leave to bond with new children and care for our families. So again, California Paid Family Leave Basics. To start off, paid family leave and disability insurance are like two halves of a whole. So they are both wage replacement programs that are funded by the California State Disability Insurance Fund, which is funded through employee taxes. So your taxes. And in California, we have pay for when you can't work, if you are pregnant, disabled, caring for a family member, or bonding with a new child. In this slide, you can see the reasons again. So for disability insurance, it's for your own illness, pregnancy-related condition. For paid family leave, it is to bond with the new child, care for an ill family member, or prepare for a military exigency. So now for the eligibility requirements for paid family leave and state disability insurance, the two common eligibility requirements that these both programs share are that you have to be paying into state disability insurance and have earned at least 300 from which SDI deductions were withheld during the base period. And the difference between both, it's why you're taking the leave. So for paid family leave, you would take it if you have a new child or need to care for a seriously ill family member. And for state disability insurance, you must be unable to do regular or customary work due to your own serious illness or disability. And this does include pregnancy. And you must be in the labor market and must have suffered wage loss. And in this slide, you can see what it looks like on a paycheck stub when you are paying into the fund. So here you can see California State Disability ends and how much they are contributing. Now the qualifying reasons for paid family leave. So paid family leave provides partial pay for the following qualifying reasons. For parents, it is to bond and care for a newborn, adopted, or foster child. Leave must be taken within the first year after birth or placement. And for caregivers, it is to care for a seriously ill family member. The family member must be a child, spouse, domestic partner, parent, grandparent, grandchild, parent-in-law, or a sibling of the person who requests the leave. And while on paid family leave or state disability insurance. These programs provide partial wage replacement, so 60% or 70% of normal weekly wages, up to $1,540 per week. You can receive paid family leave for up to 8 weeks. You can receive state disability insurance for up to 52 weeks, and leave can be taken all at once or in parts, so hourly, daily, or weekly. And to access these benefits, it would be applying through the EDD website within 41 days or later with a good cause. And this is very important to highlight that citizenship and immigration status do not affect the eligibility of paid family leave benefits. And so for workers who may not be eligible for paid family leave, so there are many organizations that do not automatically pay into California SDI, as they might have their own paid leave program. So these places could be government, federal workers, independent contractors, self-employed, freelance. So it is best to speak to human resources or a union representative to understand the paid leave rights at your job if not eligible for California SDI. The EDD does also have a way for you to opt in into California SDI, and it is through the Disability Insurance Elective Coverage Program. But you do need to plan ahead for this and start opting in within time. So when the time comes, you can access the leave. And now I will pass it to Jenya.
Oh, thanks, Angelica. So like Angelica was saying, you know, talking about paid leave, sometimes what's confusing a little bit about our different leave laws is that we have laws that cover your money, and then we have laws that cover your right to take that time off, and they're often different laws. So paid family leave, it's important to remember, is wage replacement only. So it's really like an insurance program. You pay into it, we all pay into it, or most of us do. And then when it's our time to take it out, we have one of those, what they call qualifying events, a new child, or we need to care for a family member. That's when we get to draw those funds out. And you don't, but paid leave by itself doesn't require your employer to give you your job back when you return from leave. However, we do have other laws. Go ahead, go to the next slide. So when we talk about job protection, basically what that means is there's laws that are job protection laws that require your employer to protect your job, basically give you your job back when you're done from your leave, which is very important, right? We wouldn't take leave if we could never return to our jobs. So, or most of us wouldn't. So if you're covered by these separate state and federal laws, which, you know, most of us are to some extent, then you qualify to have your job back. It also is important because it means that there should be no retaliation or anything negative that comes about from you taking this leave. For example, when you're covered by these job protection laws, you maintain your benefits that you have, you know, your health benefits, other benefits, and you just shouldn't have anything negative like coming back, oh, now you're on the night shift when you were on the day shift before. You should be able to return to your job, you know, the way it was before. Next slide. So I'm going to just talk briefly about these different laws. We do have pretty, if you look at the toolkit that we'll be talking about today, or will be talked about today, or if you come to one of our more extensive trainings, we really go into this in a lot more depth. But the most important thing to know is that in California, we have some pretty strong job protection laws that impact most workers. For example, the California Family Rights Act, right now, if you are in an employer of 5 or more employees and you've worked at your employer for a year, you have job protection when it comes to bonding with a new child, caring for a family member. So that's really important. That's up to 12 weeks of job protected leave. If you would take your paid leave at the same time as this, right? So you have your job protection and your pay. A really important law that we have that even many HR representatives, and no offense if anybody here is one, just don't always know or have this right. So it's important to sometimes look it up yourself when you're going on pregnancy leave, is pregnancy disability leave in California is a law that protects your job. You don't have to be at the employer for a year. It doesn't have that time requirement. You do have to be in an employer of 5 or more. And what it does is protects your job for anything that you need to take time off while pregnant. In an uneventful pregnancy where you don't need more time, you would go out 4 weeks before you go on leave, before your maternity, before your due date. Then after you have the baby, you would still be on pregnancy disability leave just to recover from birth. But it also impacts other related things. For example, going to doctor's visits, if you had a miscarriage or any other kind of pregnancy related issue that you needed to recover from, you would be able to take this leave. It's up to 4 months if needed. Most people don't use that much time. When I had twins, I did because I was on bed rest. So I used a lot of that time. The other law that you see here, federal law, is the Family Medical Leave Act. In California, we mostly don't talk about this because California, oh, I think somebody, well, anyway, the California Family Rights Act kind of supersedes that. It's such a strong law that we really just don't talk about FMLA anymore, because FMLA, if you're in another state, for example, is you have to have an employer of 50 or more. We fought very hard with help from a lot of our allies and definitely with the partnership's help to pass a law that would make people in companies of 5 or more covered by the California Family Rights Act. But if you're from another state, you probably will deal more with the FMLA than we do here in California. So we'll have questions at the end, but that's basically the job protection laws. So paid sick and safe days. We often find that people have a lot of questions and interest in this because, you know, think about it this way. For paid leave, you're going to take that to have a baby, to care for a very ill family member, events that happen in your life but don't happen all the time. Paid sick days can happen, you know, on an annual basis. You might have a kid that has the flu, you might get the flu. They became even more important during COVID, of course. So basically, paid sick and safe days can be used for your own illness, to care for a family member. And that is just including the diagnosis, care, and treatment of an existing health condition, or preventative care, like you know, going to the doctor, annual checkups. You can use your paid sick days for any of those types of issues. And it's a little bit different than when you go on SDI. A paid sick day is just having the flu, having a cold, having some condition like that. Whereas when you go on disability, it's much more like having been in the hospital and having a longer term disabling condition. So hopefully that makes sense. The other thing that paid sick and safe days can be used for is to seek care or services related to domestic violence, sexual assault, or stalking. That's very important. And that can be anything that people need just in relation to that event. So next slide. So for paid sick and safe days, it's a little bit simpler. Right now in California, you have up to a minimum of 3 days of paid sick leave. Now, a lot of employers do provide more, but that is the minimum in California. You will have to be, for the 3 days in California, if your employer provides those, the law is that you have to be employed for 90 days and worked in California for 30 days. You accrue this time at the rate of an hour for every 30 hours worked. And then you can decide how much time to use at once, you know, but if your employer has more paid sick days, they may have different rules that go with that, but this is the rule for the 3 days. So your employer can require, oh, here it says your employer can require you to use 2 hours at a time, because it is true that if you just needed it for a doctor's appointment, for example, you might not want to take the whole day, but your employer can say, well, you have to at least, you know, take 2 hours for that time. Next slide. So basically your employer for paid sick days is the one that pays. For paid leave and the other laws that we just talked about, we all pay into a fund through our, through our wages. But for paid sick days, your employer is basically paying just like they would pay you for a regular day. And they can't deny your request for paid sick days. It's not like a vacation request or another type of request. An employer does not have to know why you're using your paid sick days. In California, we have fairly good laws that cover our privacy. So you really just have to say that you need to take the day. Your employer also can't require you to find a coworker to cover your absence as a condition of using this time. Now, anybody who's worked in a restaurant is familiar with that, calling you're sick or you can't come to work for some reason, and you call all your coworkers who you think are off that day to come in and take your shift. That definitely is something that many employers will want you to do, but it's not necessarily a requirement with the paid sick days laws. So really the rule of thumb for any of this, any time that you want to take off, is that you always want to notify your employer as soon as you can. And we all know that the whole point is having this time in the case of an emergency, but it really is, you must notify your employer as soon as you possibly can when you know you need to use a paid sick day. If it is unanticipated, it's okay just to notify your employer as soon as is practical. Obviously, in the middle of an emergency, if you were being whisked to the hospital in an ambulance, you might not have the wherewithal to call your employer. It's just as soon as possible, sometimes even having a family member do that. They can't require documentation for a doctor's, if you're sick and you're contagious, you're too sick to come to work, you aren't always going to see a doctor or have a note. So that's really not a requirement. But if you do take 3 or more days in a row, they do ask that you have that documentation, which is, I know can be sometimes kind of hard. So the impacts of paid family leave and paid sick days, this is something that we touched on a little bit earlier in this training with the partnership. It's really important. I mean, it's such a big impact on our health and well-being to have access to these things. It has not been a right throughout our whole country. Not every state even has any paid sick days or paid leave, and it's something we really want to work toward, because how important is it for people to be able to care for a family member and know that they're not going to lose their job when they take that time to be a caregiver? It really does improve your economic independence, because you can take that time without suffering a big economic hit, or and when people don't have that access, they can fall behind in rent. I mean, so many things can happen that really hurt them economically. One colleague of mine got really involved in the paid leave world because he remembers when he was young, his mother taking time off to care for a family member, losing her job, and then the whole family going into a cycle of homelessness that was really hard to get out of. So really things like this that seem small, like a few days of paid time, can really be key. So, obviously, well, maybe not obviously, but it improves employee productivity and retention in a workplace just to know they have that ability to take time off when they need it. So you really see some of these benefits as helping small businesses too, because they're really making it a better place to work, and helping to close the pay gap between men and women. A lot of times, in the past, when you think about over your whole career, how important it is to continue to contribute to retirement, et cetera, when only women were taking that time or having gaps in their career, and not sharing those responsibilities with men, and it wasn't a norm that we all take a little bit of time off and that we don't suffer a big economic setback, it can just really kind of lessen that gap. And I think that's just obviously very important for a functioning society. So that's my opinion. But we also want to increase the number of people that can take preventative care. Even just having paid sick days helps people find out if they need to take care of something faster and not let health conditions get out of control. So it just really lowers long-term healthcare costs. Next slide. So one of the things that we work on a lot in this work is as much as we pass laws and try to do a lot of work to inform people of their rights, we're always on the lookout for what are the different kinds of barriers that people have, because that's something that we need to try to address both through policy and even through things like this, like having a lot of our colleagues and people across the state help with sharing information about this. So lack of awareness is obviously the first big barrier. If you don't know you have the right to something, that's a really big barrier to access. And it's something that it is not, we found early on that low income workers, new immigrant workers, young workers, very specific, and caregivers too, were left out of having just even the information about this, whether it's, type of job, a lot of different things go into that. Administrative barriers exist in a big way here in California. Even though we have a big organization that administers paid leave, we still need to work on better language access. The application itself needs to be a lot easier and more accessible. And then really just understanding how to apply is important. But the other things that we're working on in a big way this year are some of the policy barriers that still exist. For example, we had a huge win on job protection when we went from 50 employees to only 5 employees. And working for a smaller employer now, you can still have this job protection. But this year we're working on expanding wage replacement, because we found that low-wage workers just aren't taking paid leave to the extent that higher wage workers are. And that's really inappropriate because everybody's paying into it. And then if only the highest wage workers are able to take advantage of it, that just, exacerbates the inequality we already have. So our really big push this year is we have a bill, AB 951, a Durazzo bill, and we're pushing to win 90% wage replacement, for everybody who takes paid leave or SDI. The other things we're working on are inclusive family definitions. Our families are not always just, spouse, parents, children, but a lot broader than that. Even broader than siblings. We would like people to be able to take this for chosen family or other broad, more extended family, because that's, how a lot of families in California work. And then we'll still have work to do on job protection, making sure that nobody's left out of being able to take this time and, that they're paying into. So those are some of the things that we're working on a policy level, but also on an education level. All right, Angelica.
Well, Melody and Miranda, I'm not quite sure if there's time for questions just yet, or if you wanted us to hold off towards the end.
No, I think questions are absolutely fine.
Okay. Well, if there's any questions from anyone, please go ahead and speak out, or if you want to add them in the chat. And if there are no questions as of right now, we can just finish the presentation. If any questions come up, we are happy to answer them towards the end, or follow up via email.
Oh,
There
there's
is a
one
question. Oh. Go ahead, Chuck.
So it looks like there's a question in the chat. Oh, okay, Jenya, you got to it. Thank you.
Yeah, and if anybody's interested in helping, boy, do we have stuff to do from July through August. So let us know. And I know also through the partnership is really active on this. So although the policy director's out for a little while, so yeah, we definitely need help. This is going to be we need the governor to know that Californians really want this.
Okay, well, I don't see any other questions, but again, if anyone has questions, we're happy to answer them towards the end, or again, follow up via email, and I'm happy to add my email on in the chat in a little bit. Oh, sorry. So this is one of our websites that has a lot more content on paid family leave, frequently asked questions, and it is available in Spanish. And hopefully by the end of the year, it will also be available in Chinese. And this is also one of our new resources, Know Your Rights, Pay Leave in California. And this toolkit is available in English, Spanish, Mandarin, Korean, and Vietnamese. So we will be sharing the slides out, and it is linked here, but I'm also happy to share this with Melodie and Miranda so they could share it as a PDF with all of you. And we have a few resources here. So understanding paid leave, resources for new parents, resources from the EDD. And we invite you all to join us on July 21st and July 28th from 10 a.m. to 11:30 a.m. for a webinar that is on paid family leave. So it's a series, and the first webinar will be taking time to bond, understanding how to navigate paid family leave. And then the second training will be returning to work and lactation accommodations. And this is in collaboration with the San Diego County Breastfeeding Coalition. So we invite you all to join us, and you can register by clicking on these links. And again, the slides will be shared with Melodie and Miranda so they can be sent to all of you. And I think that is it for us. Thank you for having us here today. And if there are any questions, feel free to add them in the chat. Or again, I will add my email. Feel free to email me. And I will hand it back over to Melodie and Miranda.
Thank you, Angelica. Thank you, Jenya. So much good information that you shared with us. I know that there is a lot to kind of understand about paid family leave and state disability insurance, those paid sick and safe days. But we really appreciate you taking the time to really break those down for us. So we want to talk a little bit more about that intersection between economic inequity and domestic violence and some of the resources that we have, but we will have time at the end of the presentation for more questions if anybody has those. So thank you, Miranda, for pulling up these slides. And right before we get started with the slides, I want to launch that poll again, asking folks what you can use paid family leave for. So we want to see if there are any changes based on now you having seen the presentation from Angelica and from Jenya. So I'm going to launch the poll again and see if there are any changes in the responses that y'all might have. So what can you use paid family leave for? We'll just give it a couple more moments to see if anybody else wants to respond. Okay. So I'm going to close out the poll if everybody is done responding. We've heard from almost everybody. So we can see it looks like some of the responses have shifted a little bit based on the presentation from Jenya and Angelica. So, so based on what we heard from them, we know that you can use paid family leave to bond with a new child. That might be a child who is born, a child who is adopted, or who is fostered. And we know that you can use paid family leave to care for an ill family member. So those are the different ways that you can use paid family leave. You can use the state disability insurance if you are in need of resources for a pregnancy-related condition. And like Jenya was saying, unfortunately, at this moment, you can't use paid family leave to care for an ill friend, but they did work on a bill to expand the definition of family so that if you had someone who is part of your chosen family who might be a friend, you can use that paid family leave to help take care of that friend. But that's a bill that I think, are you all still working on that bill, Jenya, the chosen family bill?
Yes, it's AB 1041 WICS. It's a WICS bill, and we are working on it this year. We have a whole work group. If anybody's interested in joining, they can email Angelica to get involved.
Thanks, Jenya. So thank you everybody for taking part in this poll again. It's great to see the responses based on us having talked about this with the coalition. So just to jump back into the rest of the presentation, we really wanted to again highlight the importance and the power of working together. So as Miranda and Jenya talked about, the coalition and the partnership have worked together for many years now to move along this work in terms of paid family leave and getting those economic supports for families. So what you can see on the left side of your screen is what we call the spectrum of prevention. So the spectrum of prevention is another tool that we use when doing primary prevention work. It's kind of like that social ecological model that we looked at earlier. And again, it's just really breaking down our society into different levels so that we can really think about doing prevention work as comprehensively as possible, because we know that it really takes working at all of these different levels in order to make lasting change within our community and our society. So again, if we start at the bottom and work our way up, we can look at things like strengthening individual knowledge and skills. So that might be like what we looked at in terms of working with individuals and people in their relationships. And so doing work like this, having conversations with the people who you have in your circle are all going to be ways to strengthen individual knowledge and skills. So I was talking to Angelica before the presentation started that I know someone who had a family member become really ill and have to be hospitalized. And, you know, after having done this work with the coalition, I was able to ask my friend if they had heard about paid family leave and if they had done any research into looking at how they might be able to use paid family leave to take care of their ill family members. So that's an example of us working at that individual and relationship level to really spread awareness about something like paid family leave. Then we can move up into promoting community education. So that might be a training like this, a webinar like this. It might be like the training that Angelica just talked about that they're going to be providing in the San Diego region to make sure that folks know about this. It's also about educating providers. So if we move up into this spectrum, we look at educating providers. And again, this is something like what we're doing with you all. So many of you work in communities, you work with survivors, you serve as advocates in your communities. And so by working to educate yourselves and participating in trainings like this, you can then use this education to share with the folks who you're working with, to share with those community members or those survivors who you might be working with. And then this work that we're doing together is really emblematic of fostering coalitions and networks. So we are stronger when we work together. And so this partnership between the partnership and the coalition is a great example of us working to foster coalitions and networks. Angelica talked about working with the coalition in San Diego. With the breastfeeding network, right? We want to use these relationships that we have in order to advance the work that we're doing. Then we can look at something like changing organizational practices. So again, that's a lot of the work that these policies around paid family leave address. So looking at things like that wage replacement, looking at things like job security, right? Those are going to be organizational practices that we can adopt, for example, in our places of work that are going to impact our communities. And then finally, what Jenya and Angelica talked a lot about was influencing policy and legislation. So when we can work to advance bills and other policy and legislation, we can work to codify some of the work that we're doing. And we know that where we put our money, where we put our attention, are really going to be the things that are prioritized. So again, I think it's just really great how we can see how the work that we are doing together and the work that you all are doing by being in this webinar, by learning more about economic justice and paid family leave, we're really all working together using the spectrum of prevention to do work preventing domestic violence through economic security and economic justice. Next slide, please.
Sorry, I'm having trouble with my slides. One moment.
Just one moment, everybody. All right, while we're waiting, are there any other questions or thoughts that are coming up for anybody regarding anything that we've talked about so far? All right, well, there'll be plenty of time for you in case anything does come up.
Gotta love technology. My slides are not working anymore, but I do have the paid family leave toolkit up that we can talk through. Melodie, if you're good with that.
Yeah, of course.
Okay, perfect. Let me show my screen. So this is a tool that we had created in collaboration with the Work and Family Coalition that really is going to be a support for folks to take away all of this information, because we recognize like one training is not going to be the end all be all of learning all the ins and outs of these elements. So this really is going to be able to give you a good overview of the paid family leave and paid sick days. And so as you go through the toolkit, and I'm trying not to scroll too fast, it's always, of course, going to be the introduction. It's a little bit about our organizations. Scroll by page. So when we look at the table of contents, there's a lot of information that's going to be in here. And if you're wanting to look at specific things, like what kind of money do you receive? Am I eligible? How do I apply? What happens to my job? And same with the paid family leave and the paid sick days, and being able to go through that and looking at what some of those barriers also can be, particularly for immigrant workers. Also, there's a lot of hands-on approaches in terms of knowing your rights, as well as what are those training and principles, what it means to be inclusive in your language, practicing language justice, much like we do in making sure that we have ASL interpreters, and we always ask for what language access do folks need, whether that is spoken or through American Sign Language. And recognizing that we don't always know everything about it, and that's okay. So what are those other pieces that we would need? There's some sample workshops, whether you have 30 minutes or you have a full hour, and supporting materials. So I'm going to take us just a little bit through that. There's some toolkits or elements on how to use it and when. And then what exactly is it that you're looking for, and being able to find those supporting materials that are all part of this, including your sign-in sheets, screening questions for service providers, and sample leave letters. So it's going to give you some different scenarios as well to think through and what those could look like. Sorry for all the background noise. And being able to make this smaller. What kind of money do you receive? Are you eligible? And being able to give you that support as you're going out and taking this information out into your communities, of knowing what those options are and what those rights are. This toolkit also is available in English and Spanish. We are hoping later on to be able to get it into additional languages, but we will make that available for everyone who is participating in the training. And if you have others who want to access, it is available on our website as well. What are the things that happen to your job when you qualify for job protection, and a lot of the things that we were talking about today? What's your eligibility around paid sick days? And knowing what happens to your job. Once you start getting down, talking through what are some of those benefits of paid family leave and paid sick days. Talking through some of those barriers. And the knowing your rights and being able to go through, again, those tools, practicing language justice, practicing being inclusive in your language, including that hands-on practice, and knowing that we know as much as we know, and then who are the experts that we can connect with to make sure that we get those answers that we need. There's some sample curricula in here as well. And Jenya, please feel free to jump in at any point. I know you did a huge amount of work on this as well. And being able to have your checklist, which is incredibly helpful, of, you know, what qualifies when, what kind of time with are you using, and thinking through what are all those different pieces for folks that you can provide for everybody who is attending the trainings, or community members that you're wanting to educate on what their rights are. Again, there's some different scenarios as you go through, and the 60-minute training as well as the 30, being able to think about what kind of time frame do you need. And then just walking you through each of those elements. And let me go ahead and stop sharing. So as I said, the toolkit is available for everyone in both English and Spanish. And just want to open up for questions, comments. Maybe Angelica, Melodie, Jenya, anything else that you're wanting to add, please do so.
I mean, I would just add that it was a good experience when we were simultaneously working on this toolkit. We did a series really at the very beginning of the quarantine part of the pandemic, where we had actually planned them to be in person, one in LA, one in the Central Valley, and one in the Bay Area in Contra Costa County. And we ended up having to do them online because that was when, you know, the quarantine was happening. And it was really good learning experience. And what we developed out of that is a lot of feedback. And the checklist that's in this toolkit has been a really helpful thing that we've kind of developed a bit and put in, you know, some of our shorter trainings. And so a lot of what we do now, our training in the coalition, we really learned from that experience of doing those big trainings. So, you know, we kind of use some of these tools that are in the toolkit to, you know, train people. And the goal is really kind of like Miranda was saying, it's not so much that you're now this legal expert giving people legal advice, of course not, but it's more like if more people in communities across California can just point people in the right direction, we can just have a lot more people accessing their rights. So that's all I had to add, really.
Thank you. And unfortunately, my PowerPoint is completely frozen, Melody.
Okay, no problem. So one of the next things that we wanted to talk about was another opportunity that we wanted to offer to y'all to be able to continue this conversation about economic justice, paid family leave, diving deeper into the connections between domestic violence and health inequity. And that opportunity is our peer learning circle. So some of you might be familiar with the fact that we have peer learning circles that already exist. We have one for the LGBTQIA+ community. We have one for safer school communities. We have one for prevention supervisors, and we will be launching a new peer learning circle on economic justice. And we're really looking forward to this peer learning circle because it'll give anybody, not just folks who practice prevention, but really anybody to join in the conversation and be in a peer sharing space. And so as part of this space, we want to offer opportunities to, as I mentioned, talk more about economic justice and talk about how economic justice would help us to work to prevent domestic violence from happening in the first place. It'll also give us space to talk more about paid family leave, so that we have a network of folks who are aware of what paid family leave is and able to talk to their communities, talk to their clients or survivors about paid family leave, and also to give us opportunities to talk about these different trainings and really discuss, are we out in the community providing paid family leave trainings? What are those trainings looking like? What sorts of folks are attending those trainings, and what sort of information are folks taking away from those trainings? So as I mentioned, we're getting ready to launch that new peer learning circle. It should be launched in the next few weeks, probably in July, I think. And again, we'll just be able to dive deeper into these conversations and have a space where we can all talk about these things together. So we're really excited about that peer learning circle. And one thing I'd love to do is to find out if anybody is interested in joining the peer learning circle. So I'm going to launch a poll just to kind of see what folks are thinking when it comes to this peer learning circle. So there's no pressure in any way. We would love to see you there, but we know that everybody has a lot on their plates right now. So just interested in finding out if people might be interested in joining this peer learning circle. And while we have the poll up, Miranda, I'm wondering if there's anything that you would add. I'm seeing a lot of folks in the poll right now are saying, tell me more. So what would you add about this peer learning circle that might entice people to join?
This is really going to be a learning space. We're not expecting people to come in and have all of the answers. It's really being able to talk with each other and talk with other advocates who are including this work or wanting to include this in their work as they're going out into their community and developing more partners. If there are community partners that you are already working on economic justice with as a means of prevention, invite them to the peer learning circle. It is not just preventionists. It's not just for members of our coalitions. We really want for folks to be able to come into this space to learn with and alongside of us and your peers, and thinking about how, if you're just curious of like, how would I integrate this into my work? Come join the peer learning circle and let's talk about how you can bring this into the work that you're doing every day. And in terms of additional training opportunities, I know I had put the links in a minute ago. I want to go ahead and put I just put the flyer in for the paid family leave training that is coming in July for the 21st and the 28th. So hopefully folks are able to gather that. And with the peer learning circle, know that if you like I can attend this month, but maybe not next month. That's okay. These are an open space for people to be able to come in and join. And if your response is tell me more, I would encourage you put your name and email in the chat, whether you send that to Melodie or myself privately or just in the open chat, either way. That way we can connect with you and talk more individually about what this is going to entail, what kind of things we're expecting from participants and what participants can expect from us.
All right, so I think that that was what we wanted to talk to folks about, just to really, again, reiterate how excited we are to continue this work about economic justice, make sure that there's outreach about, what paid family leave is. Jenya, are you all still working on the bill about collecting the race and ethnicity data when it comes to paid family leave?
Yeah, that's SB 1058, and it's also a Durazzo bill. It hasn't had a lot of opposition or anything, so it's not quite the same grassroots pressure, but it's one of the ways that we are, like Melodie, you're involved in the PFL advocates group that meets with the EDD. It's one of the ways that we can get more information about who is and isn't benefiting from paid leave. We do have income data because it's based on income, but there's a lot of data that's missing in terms of who's left out. So this bill would race and ethnicity data, and I think it also impacts things like, we'll ask questions like LGBTQ status and other things. So we'll learn a lot from this if it passes.
Thanks, Jenya. So, as part of what I think all of us have been saying, it's that paid family leave is something that's out there, but it's not always something that folks know about. And so by gathering some of this data, like for the bill that Jenya was just talking about, it's really seeing who is not getting this message, who is not getting information about paid family leave. And I know the goal of gathering that data is that then we can do outreach to the communities that are not hearing about this so that everybody is aware of what paid family leave is, what's the state disability insurance is, what these paid sick and safe days are, so that everybody learns about it and everybody has the opportunity to take advantage of these resources when they need them, because we know that it's so critical. We know that, again, like we've all been saying, that financial security, financial insecurity is something that is a root cause of domestic violence. And so if we can work to address that financial insecurity, those economic inequities, that then we can work to preventing domestic violence from happening in the first place. The last thing I'm going to do is I'm going to put up just one more poll. We were really excited to hear from everybody today. And so this last poll that I wanted to put up is to ask folks, are you interested in training? So maybe you're still thinking about that peer learning circle. Maybe you're thinking about what sort of commitment it might be to be in a monthly peer learning circle, but maybe you're interested in a training to learn more about paid family leave, to learn about how you might be able to take this education out into your communities. So we would love to know if you might be interested in one of these trainings. We're going to be offering trainings through the partnership. The California Work and Family Coalition is doing trainings all the time. And so there's lots of opportunities to learn more about these different services and resources for folks. All right, so I'm seeing some responses from folks. It looks like we've got some folks who are interested in these trainings, which is awesome. Like Miranda said, if you are one of the folks who are saying, tell me more, please leave your name and email in the chat. That can be even a private chat to either Miranda or myself. We'll take down your information so that we can tell you more about what these trainings might look like. But it does look like some of you are interested in these trainings. So what we'll make sure to do is ensure that everybody has access to those trainings when we have them available to you. So we'll be definitely sharing more information about what sorts of trainings will be available in the coming months, so that we can continue this this learning journey for all of us. Miranda, is there anything else that you would add before we move on to a space for questions?
Nope, just my gratitude for everyone for being here today, and Jenya and Angelica for all of the amazing work that you do and have been doing, and your support in this webinar and the toolkit, all the things.
Yeah, thank you so much, Jenya and Angelica. You all are such great partners. You really offer a lot of spaces for us to be able to collaborate with you. I really appreciated learning more about paid family leave. I know that disability insurance and paid family leave have impacted me personally, and that it's something that I take to heart a lot. And so it's wonderful to know that there are such amazing advocates like the both of you and everybody else at the coalition who are really just looking to expand these rights for people and do more outreach so that everybody knows more about these. So thank you to both of you for all of the hard work that you do. So again, just want to open it up. If there are any questions, we are here. We'll be sticking around for a little while if you all have any questions. In the meantime, I would like to thank our ASL interpreters for being here. Again, just for expanding access to different folks in our community to be able to get this education. Again, we're all about spreading this awareness and making sure that folks know about these things. So thank you so much to our interpreters. Thank you to my colleagues from the partnership, Kimmy and Miranda, for being here. Miranda being a great presenter with me. And like I said, thank you so much, everybody. And we will stick around if there are any questions. All right, then I hope that